Would you like free audiobooks? Click the link in the description. Question 1. A pregnant woman at 32 weeks gestation is admitted with preeclampsia. Which laboratory finding would the nurse prioritize? A. Hematocrit 35%. B. Platelet count 90,000. C. Fasting blood glucose 100 mg per deciliter. D. Hemoglobin 12. Answer, B. Platelet count 90,000. Rationale: thrombocytopenia, low platelet count, is a critical concern in preeclampsia and can indicate severe preeclampsia or HELP syndrome, both of which require immediate intervention. Question 2. A 25-year-old G1P0 woman presents at 10 weeks gestation with hyperemesis gravidarum. Which intervention is most appropriate to initiate first? A. Administering antiemetics. B. Starting intravenous fluids. C. Offering small, frequent meals. D. Educating on dietary changes. Answer, B. Starting intravenous, IV, fluids. Rationale: IV fluid administration is the first-line treatment to correct dehydration and electrolyte imbalances in hyperemesis gravidarum before initiating other treatments such as antiemetics or dietary changes. Question 3. During a postpartum assessment, a nurse notes a firm fundus that is displaced to the right and a moderate amount of lochia rubra. What should the nurse do next? A. Massage the fundus. B. Check the maternal bladder. C. Increase IV fluids. D. Notify the healthcare provider. Answer, B. Check the maternal bladder. Rationale: a displaced fundus is often due to a full bladder, which can interfere with uterine contractions and increase bleeding. The nurse should assist the patient in emptying her bladder. Question 4. A nurse is caring for a patient in labor with a history of heart disease. Which of the following findings should the nurse report immediately? A. Respiratory rate of 20 breaths per minute. B. Mild pedal edema. C. Crackles at the bases of the lungs. D. Heart rate of 80 beats per minute. Answer, C. Crackles at the bases of the lungs. Rationale: crackles can indicate pulmonary edema, a serious complication in patients with heart disease. This requires immediate medical intervention to prevent further cardiac decompensation. Question 5. A nurse is assessing a newborn who was just delivered via cesarean section for breech presentation. What is a priority assessment? A. Checking for hip dysplasia. B. Assessing for meconium aspiration. C. Monitoring for respiratory distress. D. Evaluating for facial bruising. Answer, C. Monitoring for respiratory distress. Rationale: newborns delivered via cesarean section, especially for breech presentation, are at higher risk for respiratory distress. Prompt assessment and intervention are crucial. Question 6. A nurse is teaching a prenatal class about the signs of true labor. Which sign should be included? A. Irregular contractions. B. Contractions relieved by walking. C. Pain felt in the lower back and radiating to the abdomen. D. Absence of cervical dilation. Answer, C. Pain felt in the lower back and radiating to the abdomen. Rationale: true labor contractions typically start in the lower back and radiate to the abdomen. They become more regular, intense, and are not relieved by walking. Question 7. A woman at 28 weeks gestation is diagnosed with gestational diabetes mellitus. Which fetal complication should the nurse monitor for? A. Macrosomia. B. Intrauterine growth restriction, IUGR. C. Polycythemia. D. Hyperbilirubinemia. Answer, A. Macrosomia. Rationale: gestational diabetes can lead to macrosomia, large for gestational age infants, due to increased insulin production and glucose transfer from the mother to the fetus. Question 8. A patient in preterm labor at 34 weeks gestation is prescribed betamethasone. What is the purpose of this medication? A. To decrease maternal blood pressure. B. To promote fetal lung maturity. C. To prevent neonatal infection. D. To stop preterm labor contractions. Answer: B. To promote fetal lung maturity. Rationale: betamethasone is a corticosteroid used to accelerate fetal lung maturity and reduce the risk of respiratory distress syndrome in preterm infants. Question 9. A nurse is caring for a patient with severe preeclampsia. Which assessment finding requires immediate intervention? A. Blood pressure of 160 over 110 mm of mercury. B. Proteinuria of 3+. C. Deep tendon reflexes of +4. D. Mild ankle edema. Answer: C. Deep tendon reflexes of +4. Rationale: hyperreflexia, +4 reflexes, is a sign of central nervous system irritability, which can precede eclamptic seizures and requires immediate intervention. Question 10. A pregnant woman at 37 weeks gestation with a history of cesarean section presents with contractions. Which of the following is a priority concern? A. Fetal malposition. B. Precipitous labor. C. Uterine rupture. D. Postpartum hemorrhage. Answer: C. Uterine rupture. Rationale: women with a history of cesarean section are at increased risk for uterine rupture during labor, especially with contractions. This is a medical emergency requiring immediate attention. Question 11. A postpartum patient is experiencing heavy bleeding and a boggy uterus despite uterine massage. Which medication would the nurse anticipate administering? A. Oxytocin. B. Magnesium sulfate. C. Betamethasone. D. Terbutaline. Answer: A. Oxytocin. Rationale: oxytocin is used to stimulate uterine contractions and control postpartum hemorrhage. It is the first-line medication for managing a boggy uterus. Question 12. A patient in labor is receiving epidural anesthesia. What is an essential nursing action following the epidural placement? A. Monitoring blood pressure frequently. B. Encouraging ambulation. C. Providing clear liquids. D. Administering oxygen. Answer: A. Monitoring blood pressure frequently. Rationale: epidural anesthesia can cause hypotension. Frequent blood pressure monitoring is crucial to detect and manage any hypotensive episodes promptly. Question 13. A nurse is providing care to a patient with placental abruption. Which of the following is the highest priority intervention? A. Administering tocolytics. B. Monitoring fetal heart rate. C. Preparing for emergency cesarean section. D. Providing pain relief. Answer: C. Preparing for emergency cesarean section. Rationale: placental abruption is a medical emergency that can compromise fetal oxygenation. Preparing for an emergency cesarean section is often necessary to ensure fetal and maternal safety. Question 14. A nurse is assessing a pregnant patient at 24 weeks gestation who reports headaches and visual disturbances. Which condition should the nurse suspect? A. Preeclampsia. B. Gestational diabetes. C. Placenta previa. D. Preterm labor. Answer: A. Preeclampsia. Rationale: Headaches and visual disturbances are common symptoms of preeclampsia, a hypertensive disorder of pregnancy that requires careful monitoring and management. Question 15. A newborn delivered by a diabetic mother is at risk for which condition? A. Hypercalcemia. B. Hypoglycemia. C. Hyperbilirubinemia. D. Hypothermia. Answer, B. Hypoglycemia. Rationale: infants of diabetic mothers are at increased risk for hypoglycemia due to elevated insulin levels after birth when the maternal glucose supply is suddenly interrupted. Question 16. A nurse is caring for a patient with oligohydramnios. What is the primary concern for the fetus? A. Neural tube defects. B. Fetal lung immaturity. C. Cord compression. D. Polycythemia. Answer, C. Cord compression. Rationale: oligohydramnios, low amniotic fluid, can lead to cord compression, which poses a risk for fetal hypoxia and requires close monitoring. Question 17. A nurse is assessing a patient at 36 weeks gestation with suspected placenta previa. Which of the following interventions is contraindicated? A. Performing a vaginal examination. B. Monitoring fetal heart rate. C. Conducting an ultrasound. D. Assessing maternal vital signs. Answer, A. Performing a vaginal examination. Rationale: vaginal examinations are contraindicated in placenta previa due to the risk of causing severe bleeding. Diagnosis is typically confirmed via ultrasound. Question 18. A nurse is caring for a patient in active labor who is HIV positive. What is the most appropriate action to reduce the risk of mother-to-child transmission? A. Encouraging vaginal delivery. B. Administering intravenous cytovudine, AZT. C. Providing breastfeeding support. D. Performing frequent cervical examinations. Answer, B. Administering intravenous cytovudine, AZT. Rationale: administering IV cytovudine during labor reduces the risk of vertical transmission of HIV. Elective cesarean delivery and avoiding breastfeeding are also strategies to reduce transmission risk. Question 19. A patient at 20 weeks gestation presents with painless vaginal bleeding. What condition should the nurse consider? A. Abruptio placentae. B. Ectopic pregnancy. C. Placenta previa. D. Preterm labor. Answer, C. Placenta previa. Rationale: painless vaginal bleeding in the second or third trimester is often indicative of placenta previa, where the placenta partially or completely covers the cervical os. Question 20. A nurse is providing care to a patient with preterm premature rupture of membranes, PPROM, at 30 weeks gestation. Which of the following is a priority intervention? A. Inducing labor immediately. B. Administering antibiotics. C. Performing a cesarean section. D. Initiating magnesium sulfate. Answer, B. Administering antibiotics. Rationale: administering antibiotics is crucial in PPROM to prevent infection and prolong pregnancy. Immediate induction or cesarean may not be necessary unless there are signs of fetal distress or infection. Question 21. A patient in labor is experiencing severe lower back pain. Which fetal position is likely causing this pain? A. Occiput anterior. B. Occiput posterior. C. Transverse lie. D. Breech presentation. Answer, B. Occiput posterior. Rationale: severe lower back pain during labor is commonly associated with the occiput posterior position, where the fetal head presses against the maternal sacrum. Question 22. A nurse is assessing a newborn with jaundice within the first 24 hours after birth. What condition should be considered? A. Physiological jaundice. B. Breastfeeding jaundice. C. Hemolytic disease of the newborn. D. Late onset jaundice. Answer: C. Hemolytic disease of the newborn. Rationale: jaundice within the first 24 hours is often pathological and can be due to hemolytic disease of the newborn, requiring prompt evaluation and treatment. Question 23. A patient at 28 weeks gestation is diagnosed with intrauterine growth restriction, IUGR. Which of the following is a priority assessment? A. Amniotic fluid index. B. Maternal blood pressure. C. Fetal heart rate monitoring. D. Fundal height measurement. Answer: C. Fetal heart rate monitoring. Rationale: fetal heart rate monitoring is essential to assess the well-being of the fetus with IUGR, as these fetuses are at higher risk for hypoxia and other complications. Question 24. A nurse is teaching a prenatal class about preterm labor signs. Which sign should be included? A. Regular, painless contractions. B. Vaginal bleeding. C. Sudden weight gain. D. Pelvic pressure. Answer: D. Pelvic pressure. Rationale: pelvic pressure is a common sign of preterm labor. Other signs include regular contractions, lower back pain, and changes in vaginal discharge. Question 25. A patient at 38 weeks gestation presents with severe itching, especially on the hands and feet. What condition should the nurse suspect? A. Preeclampsia. B. Cholestasis of pregnancy. C. Gestational diabetes. D. Urinary tract infection. Answer: B. Cholestasis of pregnancy. Rationale: severe itching, particularly on the hands and feet, is characteristic of cholestasis of pregnancy, a liver disorder that can increase risks for the fetus and requires medical management. Visit nursestudy.net for more nursing practice exams, care plans, and study guides.